Morning, wake up. Welcome back, everybody. You know, you're probably getting inundated this time of year with the either emails or snail mails or, messages coming by smoke signal here asking you about, do you want to change your health care? You want to change, for me, it's talking about my mom's Medicare plan and their prescription Part D, et cetera, et cetera. All these things, it's the changeover. It's the open enrollment time. And you get bashed here. So, once everybody gets opened and enrolled and laid out and dressed, where do things stand with healthcare costs? Right now, we are looking at healthcare spending rising. And this is just coming out from the Department of Health and Human Services, rising over the last year and rising now at the fastest pace since President Obama took office. It has now reached historic numbers here. $3 trillion in 2014. That's $9,523 for every man, woman, and child in the country. As a 5.3% increase, it followed up a 2.9% increase 2013. So where are things going with this overall? Is it going to continue to grow and spiral and be inflationary? That's certainly the opposite of many other things in our economy. Health insurance expert Danny O'Connell joining us now to discuss. Good morning, Danny.
Good morning. How are you?
I'm doing all right. Okay, so I paint a rather dire picture. Those are just numbers coming out from a bipartisan group here, Department of Health and Human Services, the data, the annual snapshot, if you will. But the snapshot picture for many Americans is not real pretty right now.
Well, that's right. And there's, lack of transparency, communication. People are tired of their premiums going up, their plans changing, not being able to keep their doctors, all of those things.
All those things. But what's alarming to you with the numbers that have just come out here and in this particular study? Anything really? I mean, you're not surprised, right?
Well, I'm not. The issue that I would say is most alarming is that when we sat and really analyzed the law and the bill as it has continued to evolve, most of us looked at the year 2020 being kind of unsustainable, make or break point. But I'd say the alarming thing is it's happened much faster than what we thought. You're saying now for 2016, the plans that are available to an individual in the open market are now worse than the plans that they replaced from 2013. You have fewer doctor options, fewer provider options, larger out-of-pocket expenses. So for individuals, okay, my premium may have gone down some for some folks, but now my out-of-pocket expense is so much higher that it's really unsustainable for me to even go and get treatment when I need it.
Do you think is this largely dependent on who controls down the road, who controls Congress, and even the White House? Because, and the reason I'm asking that is when you talk about non-sustainable, that means you're hinting at a crash of the health system, non-sustainable. Does that send us running towards single payer? Does that send us the opposite way, saying we got to blow this up and start over again?
Well, it depends who's in control at the time. So when, not if, but when this thing does fall apart, if you have one side, they're going to say, see, look, we tried it your way, having private insurance, it just didn't work out. You need us to come in and save the day, overhaul this, take care of it. Or you have the other people that are saying, well, look, you passed this, you had everything, carte blanche, blank bill, passed it to see what was in it, did it, and it didn't work out. So clearly that's not the answer.
Will you be surprised if we get to 2020 and there isn't a major overhaul, a clear out of the system, or at least it's improved from where it is today vastly? If there isn't something major that occurs, will you be surprised?
I would say and hope for the American public that there would be a major overhaul before that point, because it's just clearly unsustainable. And we're at that tipping point now of which way is it going to go. So we as Americans, we deserve better than this, and we need a change in the direction that it's going.
Is there anything you like about Obamacare? I mean, is there anything about this that's been a plus in your mind?
Yeah, so the good thing is there are subsidies for individuals that do help with the premium payment of their plans, but the reality is they're only applied to the absolute lowest level plan. So if somebody can't afford, $800 a month, that's great. My insurance plan is now cheaper. However, when I go to see a provider, I've got to try to find somebody who's going to take me, and now I'm required to pay $6,850 out of pocket before my plan covers anything. Well, if I can't afford the premium, how am I supposed to cover $6,850, right?
No, it's problematic. That's to say the very least. Is that an area where, I mean, is the financial, not talking about what kind of care is strictly provided, but just what's done with those upfronts, the deductibles, what things you have to meet in addition to your premium cost minus any subsidies? Is that something that's going to have to be addressed first, or is that further down the road, or does it all have to be done as one big package, or it doesn't work?
I think it's going to be one of those things where it's like, how do you eat an elephant one bite at a time? And there's so many things that need to be addressed that you really need to look at, okay, what is working, what's not working, and let's start working on some of these. And, okay, we can fix 2 or 3 things maybe a little bit easier than others. Open up and give people other options. So if I want a higher out-of-pocket plan to lower my cost, I'm willing to take on that risk, like some people are, then allow people to have that option. Start opening up and really allowing facilities and providers to set more of a pricing than it being kind of mandated and regulated and set and filed. It's the free market really is great at setting pricing and setting demand and allowing people to go where they want. So when you start to take that away, it makes it tougher and drives up prices.
Danny O'Connell, health insurance expert. Danny, where can we find you online? www.brg-tx.com. BRG, like Benefit Resource Group. BRG-TX as in Texas.com. Danny O'Connell, thanks for joining us this morning.
Thank you.
More coming up on the Morning Wake Up. We ask you to remain in your seat, or you can get up and move around, but you have to come back. 1320 WILS.